Can you introduce yourself?
Hello everyone, my name is Mark Melias. I'm a cardiovascular and thoracic surgeon from Indian River Medical Center, here to talk to you about the heart.
What is the cardiac cycle?
The cardiac cycle consists of two phases, an active phase called systole and a passive phase called diastole, where the blood in the body is directed through one-way valves in the heart to move the blood to deliver oxygen to the tissues.
What is the difference between systole and diastole?
Systole, the active phase in the cardiac cycle, is where the cardiac muscle cells actually contract and force the blood from one chamber to the next in an orderly fashion in order to deliver oxygen to the tissues. Diastole, the passive phase of the heart cycle, is where those muscles relax so the chambers can be engorged with blood and filled prior to depolarizing or ejecting the blood in the systolic phase to the next chamber.
How does the heart coordinate systolic and diastolic movements?
Systole and diastole are intimately coordinated through the heart's conduction system. Allow me to use this classic Wigger's diagram to try to help explain it to you. In this diagram, you'll notice there are aortic pressures, atrial pressures, ventricular volumes, the electrocardiogram, or the EKG, denoting the electrical signals on the heart, and a photocardiogram, which is what you would hear if you listened with a stethoscope, the classic lub-dub, lub-dub. These are two cardiac cycles. When the EKG is stimulated with what we call the first bump, or the P wave, that's when the atria contract. As these come into the right atrium and ejects it across the semilunar valves called the tricuspid valve and the mitral valve into the ventricle chamber. As the QRS waveform depolarizes the ventricle pressure shoots up and it ejects blood out the aortic valve and the pulmonic valve into the aorta and the pulmonary artery. As the ventricle contracts, it reaches its peak force and then relaxes. As it relaxes, this is what we call diastole in the heart cycle. As the ventricle relaxes, the atria is relaxing and filling with volume. You'll notice this line goes up when you look at the atrial pressure. As the atrial ventricle contracts, it reaches its peak force and then relaxes. As it relaxes, this is what we call diastole in the heart cycle. As the ventricle relaxes, the atria is relaxing and filling with volume. You'll notice this line goes up when you look at the atrial pressure as the atria are starting to fill with blood coming back to the heart. Once the P wave fires again and causes the atria to contract, it forces blood across that tricuspid valve into the right ventricle, and the cycle repeats itself. So you can see how the electrical system of the heart really is the signals that causes the chambers to contract and force blood across those one-way valves to keep the heart efficient, delivering oxygen to the tissues.
How is the heart cardiac cycle controlled?
As we were saying, the superior vena cava and the inferior vena cava receive desaturated or unoxygenated blood from the tissues. It then collects in the right atrium. As the right atrium contracts, it forces the blood across the tricuspid valve into the right ventricle. The right ventricle then contracts and forces the blood across this pulmonic valve into the pulmonary artery. It bifurcates into the left lung and the right lung, where the lungs exchange carbon dioxide for oxygen. As the blood becomes saturated again with oxygen, it comes back to the heart through the pulmonary veins on both sides into the left atrium. The left atrium then contracts and forces the blood across this mitral valve into the left ventricle. Once the left ventricle contracts, it forces the blood full of oxygen across this aortic valve here into the aorta, where it's distributed to your head through the aortic arch and down through the descending aorta to the rest of your body. That's a good question, Christian. There are specialized cells in the heart called pacemaker cells. They're located in the sinoatrial node. These cells are chock full of ions, and as sodium and potassium exchange across a membrane, they cause an electrical stimulation in these cells. As this depolarization wave goes across the atria, it causes the atrial muscle to slowly contract, ejecting the collected blood in the atrial chamber across the tricuspid valve or the mitral valve into the ventricle chambers. As this action potential comes down, it hits the AV node, the atrioventricular node. There's a slight delay that occurs as it crosses the AV node. Then this electrical signal gets picked up by specialized Purkinje cells, where it rapidly transmit the electrical impulse down the septum, both the right and the left ventricles, and causes the ventricular muscles to then contract, forcing the blood across the aortic valve and across the pulmonic valve into the pulmonary artery and the aorta. This is a highly coordinated dance between the atrial chambers, which lead, and the ventricular chambers, which then follow.
How do pacemakers help people with heart issues?
Pacemakers are fascinating inventions. They probably have saved more lives than any invention known to man. When a patient's sinoatrial node or their atrioventricular node becomes diseased and can no longer transmit those electrical impulses, the heart fails to beat. If the heart doesn't beat, there is no blood ejected from the heart into the aorta, and the patient doesn't have a blood pressure and will expire. What a pacemaker does is it simulates that conduction system between the sinoatrial node and the AV node and utilizes a little stimulus of electricity to stimulate that heart muscle, just like those conduction cells we just talked about. So, if your sinoatrial node becomes dysfunctional and doesn't stimulate the atria, you'll need an Well guys, I hope I haven't bored you. Obviously, you know the heart is the organ I love the most and I'm fascinated with. So if you ever have any questions about it, please feel free to ask me or ask Christian to get in touch with me, and I'll be more than happy to share my experiences and thoughts about the heart with you anytime. Hope you guys enjoy your senior year. Bye. I guess they're all not seniors.